Watching.
As the number of Americans over the age of 65 increases, cosmetic surgeons are seeing a spike in their desire for procedures to turn back the hands of time. In fact, elective procedures among people over the age of 65 jumped 29% between 2005 and 2010. But surgery in this age group, as you can imagine, poses additional risks and concerns. Local 10's Christy Kruger takes a closer look.
73-year-old Barbara Del Judas likes the idea of aging gracefully. She just doesn't like the way it looks.
I wanted my eyes done because I figured that would start me and maybe I would look a little bit more relaxed.
But when her surgeon told her they would have to turn off her defibrillator to perform the procedure, she backed out.
I don't know what it's like to be turned off. I don't know what the risk is, even though they would tell me no risk, but I was afraid. I was afraid.
A recent survey found that 77% of Americans over the age of 65 would be willing to undergo cosmetic surgery, but not all are good candidates. The presence of pre-existing health conditions like diabetes, heart disease, and high blood pressure make these patients high risk. Older patients don't respond as well to anesthesia and may also not heal as quickly as younger patients. The condition of their skin is also a concern.
They have to understand that even with some of the so-called miracles of plastic surgery, there are still limitations.
Because older patients will typically have deeper wrinkles and more extensive sun damage, Dr. George Perez says so-called lunchtime procedures are not recommended.
We generally need more comprehensive work, things like neck lifting and eyelid surgery and things that a lunchtime facelift is not going to accomplish.
After undergoing a successful tummy tuck, 63-year-old Suzanne McCoy went in for a full facelift. She came through both procedures with flying colors and now loves the way she looks.
I had a wardrobe of what women my age have is camouflage clothing, so it's a lot of black jackets that come way down here and cover your midsection. I don't have that anymore.
Now, the most common surgical procedures among people over the age of 65 include things like facelifts, eyelid surgery, and liposuction. Surgeries more common among younger patients like breast augmentation and breast lifts are now also gaining in popularity. With your health news, I'm Christy Kruger, Local 10 News.
Christy, thanks a lot. And for some seniors, the desire to have plastic surgery is more than skin deep. As older Americans remain in the workforce, well, some feel that looking younger will help them stay competitive.
And coming up tomorrow night at 11, who doesn't love those viral videos on YouTube? Well, what if you